It seems to me that as we're gathered here to celebrate Medicare and to celebrate the 30 years of hard work by the Coalition, that there's one person that really ought to be here, and that's Tommy. There's enough of you in this room, I can tell by the hair and the wrinkles, and I have them too, to remember, a lot of us remember Tommy. And Mike and I were chatting briefly about the old house on 301 where the NDP used to be, and how Mike came and visited there, and how I, for a very brief period when I first started working with the NDP, actually shared an office with Tommy. And if you want to be intimidated, that's the way to do it. But I want to share a little story about Tommy. And some of you who've been on the journey with the NDP for a while will recognize that, will remember this. Maybe Pat, it's a story that Pat might know. In the fall of '88, we were in the middle of an election campaign, a federal election. And elections then were very long processes. It wasn't like nice, neat little 6-week packages like we get now. And one of the things that happened during the election was that we had free time given to us by the broadcast networks. And it came in chunks. That you never knew what length the chunks were going to be. It's not like now where it's nicely regulated. So some would be 30-second chunks, and some would be 4-minute chunks, and some would be, you never knew. So we got at the very last minute a chunk of time given to us, and we had nothing to put in it. And back then the NDP had no money, and so we had no money to do anything either. And the leader was on the road. We couldn't film a talking head with him. So what are we going to do? If you don't put anything on, you lose the time. And we thought, well, it's going to run at 4 a.m. anyway, so what the heck. And someone had an old scratchy recording of Tommy's Mouseland speech. I bet you all know Tommy's Mouseland speech. Oh, yeah. And this was the days of vinyl, so I say scratchy, it was scratchy. And we had a nice illustrator who could draw some pictures, so he drew up Mouseland, drew some pictures and stuck it in front of a video camera, and off it went to the CBC and all the powers that be, and we forgot about it. September 24th, 2 billion people were watching TV around the world. It was the Olympics, and Ben Johnson was going up against Carl Lewis for the 100-meter dash. Every Canadian from coast to coast to coast was in front of their television sets, for sure. What comes on but Mouseland? Every Canadian saw and heard Tommy and heard him say, "Watch out for the little fellow with an idea." And I don't like to draw conclusions, but in that election we won 43 seats, the most the NDP has ever won. And I think it's all down to Tommy and Mouseland. Today we're here to celebrate Tommy's little fellow with an idea, because that idea is providing health care for Canadians all across the country. And I'm one of them. As many of you know, I'm a cancer patient. I'm living with stage 4 metastatic ovarian cancer. And like Kathleen, I can honestly say that if there was no Medicare in Canada, I wouldn't be here. Medicare keeps me alive. I couldn't afford my cancer treatment if it wasn't for Medicare. And you know, I bet there's a lot of us in the room, especially the women, who watch Grey's Anatomy when it comes on TV, or, you know, Mercy, or House, or whatever, these American TV shows. And we always think, oh, that would be me. That would be me in the private room with no other people around, you know, and that would be me getting the hordes of doctors come. But you know what? I think that maybe I'd be the person who was one of the 45 million people that didn't have health insurance. Because I'm self-employed, right? People who are self-employed don't have health insurance in the States. Or maybe I would have lost it because I wouldn't be able to work full-time. Or maybe it would have been capped because a lot of American health insurance programs are capped. In the United States, one person dies every 12 minutes as a result of no health insurance. That's the recent number that comes out of the Harvard Medical School. That's the figure that we have to look at. And that's just from having no health insurance. If we added in all the people that don't have adequate health insurance, the number would be staggering. And it's not just the poor and the vulnerable. A friend of mine lives in New York City, and she's suffering with lymphoma. She's married to a doctor, and they have good health insurance. We were both talking about the fun and games of going through chemo and what our worries were. And her worry, my worry was like, how am I going to get through this without barfing on the subway or something like that? Her worry was whether her insurance would pay the $16,000 per treatment that it needed for every chemo treatment. That's something we have any experience with here. And that's what the stakes are in the work that all of you do in keeping the Canada Health Act before people and in doing the work of the coalition. You know, all the discussion that's going on in the States now over healthcare reform, you would think, especially in this 25th anniversary year of the Canada Health Act, that our government would be crowing from the rooftops about the achievements of Medicare. We should be standing on our high horse and bragging to all our southern neighbors about the achievements of this wonderful healthcare system, what it means for families, for individuals, for communities, for businesses. But all we get, and it's been alluded to already, is a resounding silence from our federal government.
Shame.
It is shameful. It is shameful. Maybe they aren't talking about it because of their complete failure to act on the private healthcare clinics. It's one of the great scandals of this government and other governments before it. And I think it's been brought home to ordinary Canadians these days by the H1N1 vaccine crisis, right? Canadians understood very clearly when they were lining up for 4 hours in the pouring rain, high-risk folks trying to get their shots for themselves or their children, and then they heard about people who could pay $3,000 or $4,000 or $5,000 for memberships in private clinics, waltzing in and getting their shots. It's queue jumping, plain and simple, and that's something that Canadians understand. They understand the lack of fairness in that, and they don't like it. You know, I was reading a little bit from the government's newest missive. I like to torture myself by doing that now and then. This is the Discover Canada, it's called, the Guide for Citizenship. And this was released just last week, and it's supposed to introduce newcomers to our Canadian way of life. It's got 65 pages of information, including important things like the difference between American and Canadian football. But there is only one short sentence about healthcare. It's in a paragraph talking about social assistance programs, which is a rather odd way to see the program. And they say, the Canada Health Act ensures common elements and a basic standard of coverage. That's what they say about our greatest achievement. From my work as an ESL teacher, I can assure you that no newcomer to this country feels complacent about healthcare. The first thing they do when they get here is go and get their health card. For many of them, it's the first time in their lives they've had access to decent health care, and they treasure it as they would treasure their passport or any other example of citizenship, but not our federal